So many people have a lot of hopelessness when they have insomnia. In fact, I've had people come to say, I have no hope, and I really just hope you can help me, right? Some people have not slept for 7 hours for decades, and they tell me things like, if I can only get 4 hours of continuous sleep, that would be incredible. And they've come to embrace having insomnia as their identity. And so they start to define themselves by this condition. And this is something that I tell everyone: you have insomnia. You're not an insomniac. It seems like a very minor shift, but that is something that I want to break down today to help you understand what the real cause of insomnia is. If you know me, I'm Dr. Funke Afolabi-Brown, and I'm all about the root cause of figuring out what your sleep issues are so that you can thrive and reach your fullest potential. So this is something that I learned when I did my sleep medicine fellowship. This was something I never knew before, and I'm going to be sharing it with you today so that you become the expert when it comes to your own sleep issues, and you're not just reading some random thing off the internet. Okay, so here is the thing. We usually talk about a model. The model is called the 3P model of insomnia, and it was created by an incredible researcher called Spielman. So we call it the Spielman's 3P model of insomnia. And what do those 3Ps mean? And this is something we talk about. If you came to see us in our practice, we help you figure out. Again, this is really back to root cause, what's driving this, because when you know where you're coming from, you know where to go to. So we talk about the 3Ps. The first P is what we call predisposing factors. So what does that mean? There are certain things that predispose you for insomnia. This is why not everybody has insomnia. Insomnia is actually pretty common. Close to 30% of people have insomnia, but it's not everybody that has it. There's certain things that put you at risk. What are those predisposing factors? Genetics. So if there's a family history of insomnia, if you're more of a type A controlling individual, if you're somebody who struggles with anxiety, if you're somebody who's almost like a perfectionist, or you worry a lot, or you have things like ADHD, you just have a higher susceptibility. So at baseline, you're almost like on the edge, and it's due to no fault of yours. You were created the way you were created for your own purpose. It just is that may put you at risk. So these are the predisposing factors. The second P is what we call the precipitating factor. So you're already somebody who has tendency towards insomnia, and now something happens. What is that? It could be a good thing, a bad thing, a neutral thing, but there's a life change that happens. You get a new job, you move from a regular job to shift work, you lose a loved one, you travel, you have a new baby, right? You lost a loved one, right? So these are things that are jarring, they're life-changing, and now they've triggered a series of sleepless nights on a background of somebody who's already prone to insomnia. And so now you have the perpetuating factors. And this sometimes when I ask some of my patients, and we're doing a lot of our reflection during our sessions, and I'm like, think back, when did this all start? It is so empowering to know, because not that you can do anything to change it, but it just helps you understand what's happening in your body. And so the third P is what we call perpetuating factors. So you're somebody who maybe has tendencies. Something has happened that has triggered this. Now you're in this vicious cycle of, it's hard for me to sleep, and the harder I try, the harder it is. I have sleep-related anxiety, and I'm now doing all the things because I want to be able to sleep better. And you start to get into more of that conditioned arousal where your brain now starts to anticipate you're going to be awake in bed all night. You're going to be catastrophizing. And again, it becomes this vicious cycle. Here's what I want you to understand. Insomnia is not a brain degeneration process. This is something that, unfortunately, the media has just wreaked havoc, right? They tell you, you don't sleep well, you're going to get dementia. You don't sleep well, you're going to get Alzheimer's, right? It is not a brain degenerative process. It is a conditioned arousal. It's a nervous system issue where your body is now almost in fight-flight mode, trying to protect you. There's not permanent damage. I want you to understand that. I want you to feel empowered. Now, here's the thing. Of everything that has happened, right? The predisposing factors, it's hard to change. What am I supposed to tell you? Stop being a type A person and be a type B? Right? Like, oh, stop being anxious or whatever, right? Stop being driven. No, you can't really change that. In terms of the the perpetuating factor. Like, we can't go back in time and tell you not to have that beautiful, adorable child you had, or like your loved one raised from the dead. I can't change that, right? We cannot change that. And so that's not something we can change. The third P, the perpetuating factors become the thing that we focus on. We do really do a lot of work on focusing on that. And now, what does that entail? It entails understanding what is going into these perpetuating factors. Let me give you examples of them. I am having a hard time sleeping. I'm going to go to bed earlier. I'm going to lay in bed for 12 hours with hopes that I fall asleep. That perpetuates your insomnia, because the longer you're in bed, the more your brain feels like the bed is where we're just awake and we toss and turn. Oh, I cannot sleep, so I'm going to use alcohol to sedate myself to go to sleep. Now you're used to drinking that glass of wine every night to fall asleep. Your brain starts to think that your body is broken, your brain is broken, and you need alcohol to fall asleep. Oh, now I can't sleep. I'm going to go to the sleep aisle. I'm going to clear all the sleep medications and the sleep supplements there. Now you have this pharmacologic dependence on needing something to fall asleep. Oh, I'm not able to sleep, and so I'm going to conserve my energy. I'm not going to be active. I'm just going to sit. I'm going to call out sick. I'm going to cancel all my engagements. Now it reinforces in your brain that because you can't sleep, you cannot be the best version of yourself. And so really, at the end of the day, what we're working on are those perpetuating factors. Now, how do we navigate that? We use a powerful evidence-based tool called cognitive behavioral therapy for insomnia. You might have heard it, CBT-I. This is really about retraining your brain to learn to sleep again, retraining your brain to calm that nervous system down, to make sure that when your body and your brain gets into bed, it knows what it's meant to do in bed. It's not meant to ruminate and worry. It's meant to sleep. This is an empowering tool that has changed so many lives. Again, because you can't change what's happened in the past, but it's really in the present. And there are few things that are sort of the tenets of CBT-I. One of them is what we call stimulus control. I mean, this in and of itself alone, even if you don't practice all the other elements of CBT-I, can be a game changer. And it's really decreasing the association that your brain has with being awake in bed. So very fundamental place to start, even something that you can start tonight if you're someone who struggles with insomnia, is stop spending excessive time ruminating in bed. If you're in bed, you're not able to sleep, you have to understand that your brain is making that association. So limit the time spent in bed. Let's start with that. And you'll see that even though it feels counterintuitive because you're tired and you want to rest, well, that rest is not productive when you're in bed trying to rest for several hours. And you never know when you move from resting to frustration to sleep-related effort. So this is really one of the foundational parts of CBT-I. It's stimulus control. The second part that we really talk a lot about is what we call sleep restriction therapy. I do not like that term. And so I usually will call it bedtime restriction or creating a sleep window. And really, it reduces the amount of time that you're spending in bed awake. Again, it may feel like it's a little bit similar to stimulus control, but it actually is not. It's making your sleep more efficient, where you have a specific sleep window and you can now just go to bed when you're sleepy, stay in bed for a specific amount of time. So again, you're retraining your brain to associate the bed with sleep. Another aspect of it is relaxation therapy. So this is so important because when you're in fight-flight mode, it's very, very hard to sleep. And so we break down different relaxation therapies that would work for you. I have some people who say, I don't want to meditate. I don't enjoy it. It makes me stressed out. Okay, then we'll do something else. Progressive muscle relaxation, listening to guided imagery, whatever it is, we want you to learn to be grounded, to be in this present moment instead of your mind ruminating and running all over the place. Of course, we talk about sleep hygiene. Those are the basics. Again, things you need to know, which in and of itself independently will not fix your insomnia, but in combination with CBT-I can be very powerful. And a lot of work is done on educating you on the various aspects of your sleep. So for instance, what I've just provided to you, this is pretty much part of what I teach all my patients when they come to me for insomnia care. And this is something that we have gone into so much detail in our insomnia course. This is a comprehensive insomnia course that delves into the root cause of sleep issues, not just around insomnia, or medical issues that might be contributing, which is a very big piece. We talk about sleep in women in midlife, things that are very, very unique to your needs. We talk about the role of supplements and so many other aspects. This is a very powerful tool that you can use to get the rest and the sleep you need so that you can thrive and reach your fullest potential. So go straight over to our website, therestfulsleepplace.com, and grab this course because it will change your life. And I hope this has been helpful. We've talked about different things, but I hope, again, this is one of those videos you're going to want to bookmark, look into it. I absolutely would love it if you subscribe to this channel because it helps us get the word out. And if you can tag someone or share it with someone in your world that would benefit, that would be phenomenal. Until next time, I hope you rest well.